kita tak pakai precision.
Tablet is a solid dosage form that contains a specific amount of active ingredient, usually compressed into a round or oval shape. Tablets can be coated or uncoated and are commonly used for their convenience, accurate dosing, long shelf life, and portability. For example, paracetamol 500 mg tablets are widely used for relieving pain and fever. However, tablets may not be ideal for everyone, especially patients who have difficulty swallowing, such as children or the elderly. They also have a slower onset of action compared to liquids. Additionally, some drugs in tablet form may degrade in the gastrointestinal tract or are poorly absorbed, which can affect their effectiveness. Like many oral medications, they undergo first-pass metabolism, which can further reduce the amount of active drug that reaches circulation. Tablets should be stored at room temperature, kept dry and away from sunlight, and not crushed unless directed. Patients should swallow tablets whole and follow food-related instructions as advised. Overall, tablets are reliable and stable dosage form, commonly used across various medication conditions.
For the dosage form 2, we continue to the topical. First, we have ointment. The description stated that it is known as balm, oil-based ingredients. The advantages are convenient, good compliance since it's easy to apply and local effect. However, its absorption is low. This condition will take time for the medication to become optimal. The ointment should be stored in a cool, dry place with low 25 Celsius and avoid of direct light. It is useful in the treatment in conditions of dry and flaky skin. This dosage form shouldn't be used on broken skin. For the packaging insert should have brand and generic name, the dosage strength and form, indications and usage instructions, how to apply and store it, manufacturer information, and the expiry and manufacture date.
The intranasal route is a method of administering medication through the nasal cavity, commonly used in nasal sprays like mometasone or inhalers such as salbutamol. It allows for rapid absorption through the nasal mucosa, suitable for both local and systemic effects. Key advantages include fast onset, ease of use, and avoidance of first-pass metabolism. However, it may cause nasal irritation as limited dose volume and requires proper techniques. Medication should be stored at room temperature, away from sunlight and moisture, with clean applicators. Patients should be advised to clear the nose before use, avoid sniffing too hard after spraying, and rinse the mouth after corticosteroid inhalers. This route is widely used for allergies, asthma, and in some cases, hormone and vaccine delivery.
Medication storage and record keeping in the pharmacy store is one of the pharmacy training where we were introduced to the system used for storing and managing medications in the pharmacy store. This experience emphasized the importance of having an organized storage system and maintaining accurate records. Proper documentation is essential in preventing medication errors. From activities we conducted, we observed that medication were arranged alphabetically on designated shelves to allow for efficient retrieval. We were instructed to use a pin card to record every instance of medication withdrawal or intake. And lastly, we learned that different pen colors used on the card signified different meanings, which is requiring careful attention during the documentation. The next part is prepacking and labeling of medication dosage forms. This part of the training aimed to give us practical experience in prepacking medications and understanding the importance of proper labeling. The experience highlighted the need for precision and attention to detail in pharmaceutical prepacking. It also reinforced the role of labeling in ensuring correct medication use and promoting patient safety. From this section, we learn how to double-check the labels to ensure that these correspond accurately with the contents. and we get to learn to differentiate between white labels which is for internal use and red labels which is for external use, which is an essential aspect of patient safety.
In conclusion, this attachment provided valuable hands-on experience that deepened our understanding of pharmacy practice. We learned to identify and handle various dosage forms, as well as how different dosage forms impact drug use and patient compliance. From dispensing and labeling to pre-packing and stock management, we gained practical skills that complemented our theoretical knowledge. Observing real workflows taught us the importance of precision and patient safety. This experience has strengthened our interest in pharmacy and inspired us to continue growing into a responsible and detail-oriented pharmacist.